Thank you so much for having me today. I am really delighted to be here, and I'm awestruck by the people in the room. The YPAC group are incredible people, and all of you who are working with this population, you all make a difference. I would love to say that my whole career I've been working on hope. I came into this career, I'm a third-generation social worker. I care passionately about social work. I care about the kids in care. And I'd love it that I could say all of my work is about resilience and recovery, but in reflection, I spent a lot of time looking at despair, at depression, at anxiety, at suicidal thoughts. And on a good day, my research might have been looking at remission from depression. But if I came up to you and said, so how are you doing today? And you said, well, I got out of bed and I made it to work, I wouldn't be totally confident that I had gotten where I wanted to get to, or that I'd be concerned about your mental health. So I publish in these types of journals like Suicide and Life-Threatening Behavior, Journal of Aggression, Maltreatment, and Trauma. One journalist was kind of poking fun at where I was publishing and said, Journal of Aggression, Maltreatment, and Trauma? I didn't know Don Cherry fans had their very own journal. I had this huge paradigm shift, which actually reflects a lot kind of what Allison was saying earlier today and what the video was showing. I want to be talking about resilience. I want to be talking about recovery, but I'm focusing on all of the negatives. And there are a lot of negatives. That I'm not to say that those numbers and those percentages don't exist. I've been spending the last 5 years looking at children as they grow older, the risks of maltreatment in the long term affecting physical health outcomes like stroke or cancer or heart disease, and trying to figure out why that's so. But I was stopped one day because one of my best friends for the last 30 years, she is my role model, my role model for positive mental health, well-being. She is incredibly wonderful, loving person. She's an adult survivor of childhood sexual abuse. And she took me aside one day, and she knows what I do because I'm talking about my research all the time. I'm kind of a research nerd. Not that you would have guessed, but. So she said, but you're only talking about people that are super struggling. Many of us are doing really well. And we've seen that today, right? And many of us are doing really well, but you're only focusing on the people that are really struggling. So she said, we need to be talking about those of us who are doing well. And I really realized, okay, wait a second. It's not just my girlfriend, it's lots of other people who are doing well, but I need to understand what does doing well look like. It's not just the absence of mental illness. What is complete mental health? So a wonderful researcher in the United States, his name's Corey Keyes, has come up with a definition of mental health that I think we can all embrace. So sure enough, his number C here is we don't want in the last year that you're mentally ill, no depression, no anxiety, no bipolar disorders. We don't want substance abuse, drug or alcohol abuse. We don't want suicidal thoughts and attempts. We can all agree that that's a minimum, but that's only a minimum. That's just neutral. So we need the absence of that. And then in the last month, we want people to say every day or almost every day they felt happy or satisfied with their life. Okay, this is getting a little bit more what we're looking for. This is much closer to being in mental health. And then what about well-being? Well, social well-being, in the last month you have to have had a sense that there's a purpose and a meaning to your life. Every day or almost every day. That society is getting better for people like me. And a psychological well-being, that you feel good about most parts of your personality, that you feel okay about expressing yourself. So you have to have all three of these to be called complete mental health. The absence of mental illness, happiness or life satisfaction, and this social or psychological well-being. Okay, that's what I'm looking for myself. That's what I'm looking for my children. And most of all, that's what I'm looking for these kids in care as they grow up. I don't just want them to get to neutral. I want them to be flourishing. So I'm a researcher, that's my day job, and I know that anecdotal evidence, I know lots of people who've done this and that they've survived really, really rocky starts. I wanted to know, well, who's doing well in the general population? So luckily, Statistics Canada asked more than 20,000 Canadians, a representative sample of Canadians, about their childhood experiences and also about their, whether they've achieved this complete mental health. And the news was unbelievably positive. It turns out the glass is half full. More than half of childhood physical abuse survivors, these are adults. There was a sample of over 2,000 childhood physical abuse survivors, and there were 1,500 childhood sexual abuse survivors in this representative data set we're looking at. More than half were in that complete mental health state that we were looking at. Not just neutral, happy or satisfied with their life every day or almost every day in the last month. So the next piece is, what are the characteristics of those people who get to that stage despite these early adversities? And maybe I can take some lessons from this to help the other half get to that point. So what predicts complete mental health? So out of this sample, we found out who was most likely to be in complete mental health. Well, the first factor was older age. Most of us think that youth is the time of flourishing, but it turns out, good for the rest of those of us up here who are moving towards old age, that it just gets better. The light is brighter at the end of the tunnel. Now, obviously, I can't do much of an intervention about an older age, so let's go on to the next topic, which is having a confidant. And Alison was saying that earlier today. Having a key person to help you out makes a difference. And we know that from the child literature, but at adulthood, you need people to help you with the ups and the downs of life. You need that support. So what can we do to help people be able to build those confidants that they can go through life with? Similarly, having a partner to go through life with. It's for the similar reasons. Having somebody there makes a huge difference. Physical activity is wonderfully protective. We've known that for depression, for ages, that if you want to resist falling into depression, and if you are depressed or anxious, coming out of depression, going around the block, getting on your bike, anything you can do, it doesn't have to be grand, that makes a difference. Now, staying physically healthy, and there's a bunch of components to this. Not surprisingly, if you're in chronic pain, it's hard to be happy and satisfied with your life every day. So those basic care kind of issues. Functional limitations, so having difficulty getting around and disability made a difference. But still, many people who were adult survivors of early maltreatment, who were physically ill or had chronic pain, still were getting through, but it made it harder. Now, religion and spirituality was also very important. So people who turned to their faith or their spirituality to deal with those day-to-day stressors and strains were more likely to be achieving complete mental health. We all know a good night's sleep makes a difference. Well, chronic insomnia makes it less likely you're going to get to complete mental health. So I'm now thinking, okay, what kind of interventions do we know that can make a little bit of a difference about sleeping? These are things I'm trying to work through as I'm looking at the exemplars and saying, what can we learn from them? Now, the next three items, this one included, and we talked about this earlier today, those who end up turning, because of their traumas, to substance abuse, drugs or alcohol, they have a harder time coming up to that complete mental health stage in adulthood. Many of them do get there, but it's harder. So now I'm thinking, what kind of prevention can we do? We know that children are vulnerable to sort of self-medicating, self-soothing if they've had a really hard early life and maltreatment. What can we do early on to stop them choosing that avenue? And if they already have substance abuse issues, what can we do to help bring them out of that? Anxiety was also an issue. So adults who at some point in their life had developed anxiety disorders also had a harder time achieving complete mental health. So again, I'm thinking, what are some interventions we can do to stop that, the onset of anxiety, or certainly to promote recovery from? And one of the bigger factors was depression. So individuals who'd been overwhelmed or swept away by depression or hung over, that cloud came over them, many of them did come through, but it was a steeper road to get there. So we know what we have to work with now, because we can see the people who've done well, but how do we get the other half of these adult survivors of childhood maltreatment, how do we get them to be switching their trajectory to be going towards this complete mental health? And there's an unbelievably effective, remarkably simple, common sense intervention, and it's called cognitive behavioral therapy. And what it's saying is that the individuals who have had hard early experiences, or actually all of it, it works very well for everybody, but those negative thoughts, like, I'm not good enough, I can't do it, what's the point, I'm a loser, all of these thoughts end up undermining you day in, day out. So those early experiences, you heard those words, but now they're inside your head, and that's what's causing problems now. So it's a program. It's 12 to 16 weeks long. You have homework, and what it's doing is making you catch those dysfunctional thoughts, those negative things that you're inundating yourself with, writing them down, and it helps you rethink the logic of these thoughts, and sort of you do little homework exercises, and it actually changes the way your brain works. So unfortunately, the vast majority of the substantiated abuse cases in Canada don't get cognitive behavioral therapy. Many of them don't even get referred for mental health treatments. If they do get referred, there's long wait lists. So there's a huge problem, because we know that these children are at risk. Why don't we step in right away and try to grab those thoughts before they get even more entrenched and help them be resourceful? So this is a program that's happened in Texas, where they provided a 15-week program called Trauma-Focused Cognitive Behavioral Therapy. It's particularly focused on the childhood sexual abuse survivors. But this blue line here, I don't have a pointer, but anyway, this blue line here, what happened is that 90% of the children that they started to treat had post-traumatic stress disorder. After 15 weeks, they're down to 40%. This is like a miracle maker. Depression, about 80% of the children had depression. At the time they finished it, it was about 20%. They have follow-up of 1 year, 2 year, 5 year follow-up. These differences, they stick. So I have a dream, and you in this room are going to be able to make it into a reality, that basically 10 years from today, on May 14th, 2025, I want every abused child in Canada to have access to free and timely cognitive behavioral therapy. We want to change the trajectories. We want each and every child to be able to reach their full capacity, and this is one important strategy to get there. Thank you.